Okay, here's part two, and this is mostly your back, your vertebral column. Really important structure. Us humans, we tend to have a lot of problems with that as we get older because of how we use our bodies. Okay, so the vertebral column goes from your skull to your pelvis. You can call it spine or spinal column. It has very important functions because it supports your lower limbs and your trunk. It also protects your spinal cord, and then it's where your ribs and muscles attach. There's 5 major regions in your vertebral column, and there's 26 bones, and they're irregular. They're really weird shaped, but they're shaped that way to do their job, to be connected to all these. They have all the different markings to be connected to the muscles and also to accommodate the spinal cord and be able to move. And so the shapes are really interesting because of that. Okay, so these are the 5 parts. Your vertebral column is about 20 inches long. The very top is the cervical spine, which is your neck, and there's 7 vertebrae, so you should know the numbers of each of these. And then thoracic has 12 vertebrae, and that's kind of the middle. And then lumbar has 5, so you can remember 7, 12, and 5 for meal times. That's how you can remember the numbers. And then cervical, thoracic, and lumbar. Most people know lumbar as your lower back, and maybe you know cervical as your neck. And then sacrum is the next one. That's one bone. I'll show you that. It kind of forms like a triangle shape, and then you have your coccyx, which is fused, and it's at the very end. It's like your tailbone. Okay, so cervical, you have different curves that are healthy. So there are times when your spine could be curved incorrectly, like scoliosis or lordosis or whatever, but there are healthy curves. And so there are 4 main curves that it's supposed to be that keep it strong, and that's the right shape in terms of how we use it. You have cervical and lumbar curvatures. They are posterior, concave, and then thoracic and sacral are posterior convex. So here's what that looks like. If you look from the anterior view, it looks like it's pretty straight. If it wasn't, that would be scoliosis. But then if you look from a lateral view, you have this concave cervical curve, and then it gets convex in the thoracic, and then you have concave again in lumbar and convex in sacral. So there's your sacrum and your coccyx. And so this is a normal healthy curve. This means your lower back kind of has like a curve in a little bit, where if you're standing up against a wall, you could like kind of fit a hand behind it. And then your thoracic spine kind of comes out right here. So this is normal and healthy. You have ligaments. Ligaments are connect bone to bone. And so there's ligaments that keep all this together and keep them in place. So continuous bands from the neck all the way to the sacrum that keep everything in place so that it doesn't go backward or forward. It curves correctly and moves correctly. So here they are. This is what they look like. And of course they can be torn, they can be damaged, but very complex to keep everything in line and keep us upright. And there's another view of them. So your ligaments, remember ligaments are bone to bone. And then you have the discs, the intervertebral discs. Those are, I'm sure you've heard of somebody slipping a disc or something. So those are the little pads between the vertebrae. They act as shock absorbers. However, we have to be careful with what we do with our back, because the way our back is designed is to carry weight upright so that those cushions can absorb that impact. If we are leaning over and pulling up a lot of weight, that's not how those cushions are supposed to function. And so that's what can cause a slip disc. So that's why they tell you to, like if you're lifting something heavy, to bend with your knees and don't use your back like a bridge where it's bearing the weight, because it's not supposed to support weight in that direction. So, and they have 2 parts, the nucleus pulposus and the annulus fibrosus. So here is the nucleus pulposus, and then the outside is the annulus fibrosus, and they are super strong. They can withstand a ton of weight if used correctly. But if you're lifting things in ways you shouldn't, that's when they slip out. or they can rupture. Very, very painful, very dangerous. So we have to take care of our backs and use it in the way that is supposed to be used. And then your spinal cord is right here, well protected, right? And then this is I'm not sure which vertebrae this is, but oh, and this is a herniated disc. I'm sorry, I didn't notice that. Right here is where that disc is pushing on that nerve root, and that's going to be really painful and cause a lot of problems. Here's the herniated disc pushing on that. So protect your back. It happens a lot on the lower back because we are using our backs incorrectly. Okay, so severe trauma can cause herniated discs. They can rupture. They can slip out of place. Surgery is sometimes needed, but they're probably going to have you do physical therapy for a long time before they do surgery. So take care of your back so you don't have to experience that. You can also have abnormal curvatures. Sometimes they're congenital, sometimes they're from poor posture, like on our phones, or diseases can cause them. So scoliosis is lateral, remember how when we were looking at the like the posterior view of the spine, it was like straight. Lateral would be like, I don't know if you can see my mouse, hold on. So a straight up and down. A lateral view would be, or lateral rotation would be like this way when you're looking at it from the anterior or posterior view. And then kyphosis is hunchback. So that's scoliosis. Lateral is scoliosis, and it'll make your pelvis uneven and stuff. Kyphosis is hunchback, and then lordosis is swayback. So that's scoliosis. This is supposed to be straight. I'm trying to draw a straight line, and it's curvy. This is kyphosis. We see it in older people a lot. And then lordosis, and that can be temporary sometimes due to weight or pregnancy. Okay, so structure of the vertebrae. So there, on every single vertebrae, there are different parts. Like every single, like the 7 cervical vertebrae, the 12 thoracic, and the 5 lumbar, there are different structures of those, not of the sacrum and the coccyx are going to be different. So there's a body, there's a vertebral arch, and it's got 2 pedicles and 2 laminae. There's a vertebral foramen, vertebral canal, and an intervertebral foramina. So they all have these different structures, but they're all like shaped a little different. Okay, so this is the posterior or the back view. So if you feel your back, you can feel like a little point there of each one, and that's what you're feeling there. And then there's the 2 side processes, the transverse process. This is like we saw before, this is where the spinal cord is. You've got the pedicle right here. This is called the vertebral arch. This is the lamina, that little arm thing there. This is the body. Okay, this is the main body there, and this is right where the disc will sit. So they all look like that. There's 7 processes too, so these are like the little protrusions. We already saw some that tie into different things. So there's the spinous process, the transverse process, 2 of those, the superior articular process, and the inferior articular process. And I think that was on the last picture, so look for those. Okay, cervical vertebrae. So C1 to C7, remember there's 7. These are smallest. They're right back here in your neck. C1 and 2 are a little bit different, but C3 to C7 are oval shaped, except for 7, it's split. They have large triangular vertebral foramen. There's a transverse foramen that they have, and then number 7 is the vertebral prominence. It's larger and it sticks out, and that's normal. And that's used like as a landmark. They can tell where things are from that. So that you can feel that on you. Like when we're doing this, you should be feeling your own structures so you can know where these are. It helps you to have little bookmarks in your brain. Okay, what do we have here? So these are your C3 through C7, that's what they're called. And then this is like the movement that they allow and some differences. So triangular for those, circular for thoracic, triangular for lumbar, thinner and tapered. Let me see what else. So your cervical vertebrae allow for different movements than the other ones. So you got flexion and rotation with your neck can turn. Rotation still, and some lateral flexion with thoracic. And then you do have some lateral flexion with your lumbar, but it's more limited. And your lumbar are a lot larger. The transverse processes are thin and tapered, but the size is much larger. So this is what your cervical vertebrae look like, thoracic and lumbar. So you can see how the shapes are different. Like the vertebral foramen are different, how they fit the spinal cord. But they all have that body that's going to handle the disc. And then here's the lateral view of each of them. So you can see how much bigger the lumbar vertebrae is compared to the other two. Okay, so this is your neck. This is C7 or C3 to C7. I told you that the first two were different. The top one is called the atlas, and that's the bone. It looks very, very different from all the other vertebrae. That's the one that keeps your head from flopping backwards. Like if you didn't have this atlas here, your head would not be held in place when you dip it back. And then C2 is called the axis, and then the rest of them have the same features, except for the T7. Okay, so Atlas, like you can think of Atlas Shrugged. That's like a famous book, holding the world on his back. The guy's name was Atlas. So this one is very weird shaped compared to the others. No body or spinous process. It's got two lateral shapes. It's kind of skinnier. It carries your skull. It helps you nod. So that's the Atlas. That's what it looks like. That's C1. So pretty different. And then inferior view. Axis is number 2. So it looks similar. It doesn't have the dens part. And it allows you to move your head forward. Okay, and so here's a look at it, and then inferior. No, this is the actual photo of it. Okay, and then you have your C3 to C7. Okay, so now we're on to thoracic vertebrae. Remember, there's 12 of those, and they all kind of look similar. They have a single facet. The vertebral foramen is circular. It's not triangular like the other two. Large, sharp spinous process, and allows some rotation. So this is in like your upper back area. So we see this again. This we saw already, and that we saw already. And this is what they look like. The spinous process kind of tips down more, so you can see that in the picture, and you can feel that in your back. Kind of has a more acute angle. And then there's your disc. And then you have your lumbar vertebrae. So that's your lower back. That's often where we have most of our back problems. And these vertebrae are larger because you're so much weight. They're used so differently, and there's so much weight that's forced onto them. Vertebral foramen is triangular in these, like the cervical. They don't rotate as much, so you have these facets that lock together. So they're like short and stocky. Let's see. So yeah, we've seen these views already. There's the side view. We've seen that. And there they are. So you can see the shape is very different. And they're not tipped as far down. They're just really short and stocky looking. Okay, and then the sacrum. So sacrum is made up of 5 vertebrae, but they're fused. And it connects to the coccyx. It also connects to your pelvis, like your hip bones. It forms a sacroiliac joint that you might have heard of. So lots, what was I going to say? Oh, there's a lot of, it has to support your legs. And so there's a lot of weight that's required. And these have to be pretty stout bones to support all that weight. Okay, and then so that you have a median sacral crest, posterior sacral foramina, sacral canal, sacral hiatus, and then the coccyx is the tailbone. It has 3 to 5 fused vertebrae, and it doesn't really do a lot, but you can break your tailbone, and that can be really painful. We could probably live without it. So there it is. There's your coccyx. You can see those are kind of vestigial vertebrae. There's a little apex right here, which is the end of the sacrum. And then these are the 5 vertebrae of your sacrum, and they're all fused together. There's a posterior view of it. Okay, now we're going to look at the thoracic cage. And so that's coming off your thoracic vertebrae, going into your sternum and your ribs. And the purpose of that structure is to protect your organs. It supports your shoulders and your arms, and it connects to the muscles in your back and neck. Okay, so there's your thoracic cage. It literally looks like a cage. Some of it's bone, some of it's cartilage. So this is your sternum, and it ends in your xiphoid process, and that's the part where when you're doing the Heimlich, you need to get up under that xiphoid process, right? This is the manubrium up here. So the sternum has 3 parts: manubrium, body, and xiphoid process. These are your vertebrae. Right here is where the lumbar starts. So this is all your thoracic. And then, okay, so you have 7 true ribs, like 1 through 7 are your true ribs, and then 8 through 12 are your false ribs. And you can see that the true ribs are connected to the sternum directly, and then the false ribs are connected kind of to each other. And then you've got these 2 floating ribs, but they're all coming off of your thoracic vertebrae. Okay, so sternum is the breastbone, connects to the clavicle up here, and then you have the 3 parts that I explained. It doesn't get the xiphoid doesn't get fully ossified until you're 40. Stays cartilage. You've got some different anatomical landmarks there. You've got jugular notch, sternal angle, and I forget how to say this, xyphosternal joint. Let's see. Oh, right here, xyphosternal joint is right there. Sternal angle. This is your jugular notch, and then it's tying it to the thoracic vertebrae here, all the way down to 12. Okay. Xiphoid process. Sometimes it sticks posterior towards your inside, and that can be problematic because it can push on your tissue. When you're doing CPR or the Heimlich, you need to make sure that you're below the xiphoid so it doesn't break off, because it can puncture organs. Okay, your ribs, you've got 12 pairs. We looked at those already. The true ribs are 1 through 7. Your false ribs that are not connected directly to the sternum are 8 through 10, and then your floating ribs, 11 and 12. So there they are. We've already looked at those. Your ribs have a similar structure on all of them, kind of. So you have the shaft, which is most of the rib. It has the head that connects to the vertebrae, and then it has the neck that's like after the head, and then the tubercle. And that's another landmark that's going to connect to other things. So let's see. You've got the head right here, and then the neck. Those are common terms that we use for bones. And then the tubercle is this little notch landmark right here. And then this whole thing is the shaft. And then you've got cartilage connecting it to your sternum. Okay, so here's another view of it connecting. This is the head again, and the neck, and the you can't see the tubercle there. Okay, there it is again. And we're done. It's not letting